It is just a huge honor for me today to be podcast interviewing Dr. Shervin Molayem, DDS, who comes from a long line of family dentists. From a young age, his grandfather, a prominent general dentist, instilled a strong work ethic and love of dentistry in him. For this reason, he pursued his doctor of dental surgery at the UCLA School of Dentistry. After graduating from UCLA with his bachelor's degree, upon graduation, he received a Nathan Steyert Scholarship Award, Alpha Omega Dental Fraternity's President's Plaque, and Award of Excellence by the IADA for his promotion of diversity and community outreach programs. While pursuing his passion for surgery and dental implants, Shervin was accepted into a 3-year specialty program for periodontal implants and reconstructive surgery at USC, which really surprised me. I didn't think anybody from UCLA would go to USC. But as the founder of the UCLA and USC Journals of Dental Research, he has conducted extensive research in the field of dental implants. He has also presented his research nationally and lectured internationally for the American Dental Association, the California Dental Association, Alpha Omega, American Academy of Perio, American Academy of Osseointegration. His mission is to provide patients with personalized, excellent dental care. I could read, it goes on and on and on, but what actually made me call you, and thank you so much for responding, yesterday in the news, Beverly Hills, California periodontist Shervin Molayem, DDS, finds potential link between gum disease and severe COVID-19 complications. His study suggests that if gum disease patients have high levels of IL-6 when infected with COVID-19, they are far more likely to be hospitalized and suffer severe respiratory problems. And of course, this was big news on Dental Town, and the thread is talking about it. And I said, well, I'm just going to reach out to him and see if he'll come on the show. And thank you for coming on the show in this very timely matter about COVID-19, perio. So do you think that having periodontal disease could make you more likely to end up going to the hospital with COVID-19?
Yeah, well, first, thanks for having me on your show. I've been a long time, listener and a fan, so thanks for having me. Yes, right now it's very important. It's timely. COVID is we're I don't think we're in the peak of it, but we're hopefully settling down and things are getting better. So what I decided to do is I saw, I was home during the quarantine, saw the dental offices closed, and I saw the link, and I knew that there's a relationship between, people dying from COVID is really an inflammatory process of why people go down the bad path. It's all about the inflammation and IL-6 and CRP and different, cytokines. So we know from studying all the articles that in perio, IL-6 is flowing through the gums, getting released by the host cells, gets released by macrophages, neutrophils, T cells. Almost all of our body soldiers, so to speak, are releasing this IL-6. It releases it locally. It releases it all over the body. Endothelial cells in the blood vessels release it. So we know that already. Now, my partner and I, she's a PhD periodontist as well. We went to work, looked at all the articles, and basically saw this connection. And we are suggesting, so it's not conclusive, meaning we need clinical studies now. But this is the first comprehensive look of connecting the dots between the two.
Now, when you say your research partner, is that Carla Pontes from South Africa?
Yes.
Yeah. And what is she seeing? Is she seeing anything different in South Africa than you are seeing in California?
No, South Africa was a little bit delayed in their surge. Right now, they're surging as far as the number of cases. So she told me it's been pretty busy in the hospitals right now. But no, I wouldn't say there's anything different.
So what would you say? I guess I guess on Dental Town, the opposite of this view is that, you guys correlate periodontal disease to Alzheimer's and all these different diseases in the oral health continuum. And they always curious, is it correlation or is it causative? Like, I know personally, and this is serious, I'm the guy who makes the sun come up every morning, because when I start to make my coffee in the morning, the sun just comes right up. And I know it's all me. I cause that. It's not correlated. So a lot of people are saying, perio, is it correlated with Alzheimer's and all these diseases and COVID, or is it
Yeah.
causative?
Okay. So let's talk about Alzheimer's first, and then we'll get into COVID. Okay. With Alzheimer's, there's P. gingivalis is found in the part of the brain. It releases something called gingipain. It has a weapon that breaks down tissue in the area that they've noticed. That part of the brain is actually one of the causing factors. So if you look at the medical journals, there was an article last March. The article said they used the word cause. Now, in medical journals, they rarely do that. I think it was in the Journal of the American Medical Association. So that they know, and not only did the article say that, it said we already know this and understand it. We now are creating drugs against the gingipain so that we can decrease that. So that's Alzheimer's is P. gingivalis, and that's one of the bad bacteria. Now with COVID, so the real link comes to in our blood vessels. In our blood, when you draw our blood and you measure the number of picograms per milliliter of IL-6, when someone, there have been studies when people are in the control group, so they have no problems, no medical problems, they have no gum disease, and their measurements are between 0.25 picograms and 10. Now you have people that have periodontal disease, and they have between 0.25 and 41 picograms per milliliter. So by doing just a scaling and root planing, after 3 months when you check them, that range will go back down on the periodontal disease patients, back down to 0.25. So from an average of 3.3, it'll go down to 2.25. So 3 points of IL-6 go down by just doing SRP on a periodontal disease patient. Now, there was a study from Germany that showed that when people are in the hospital and their IL-6 level goes above 80, that is a predictor for put on a ventilator. So it's all about, and they use the word predictor because every time that goes over 80, they're on the ventilator. And also CRP, just lesser degree, but CRP is also a predictor as well. So we need to make sure and educate dentists, doctors, that we need to do whatever we can to keep the IL-6 down so that when people get into the hospital or before they contract COVID, they already have lower IL-6 levels. So that's the key thing here.
So, a lot of people are probably thinking they're driving in their car saying, "Did he say gingipains?"
Yeah.
So for everybody who heard that word for the first time and are seeing their first giraffe, that's what I always call it. That look on your face when you saw a giraffe for the first time. Will you talk about gingipains again? It sounds painful. I want you to cover it well.
Yeah. So you want me to go over what the gingipain is again? Is that what you're asking?
Yeah. I mean,
Okay.
did that? I mean, where did that name come from? Gingipain. I mean, that's just an interesting name.
It is. It is. So bacteria, they have weapons, so to speak. They have communities. They have relationships with viruses. They have. When you look at a colony or a community or in a plaque, there's all sorts of the way to really remember things is it's like a war, and like you have alliances, and each of these bacteria, they have friends, and they work better with others, and some have a weapon that could break down collagen. One of them has a weapon that could break down bone. So gingipain is a weapon that is secreted by the P. gingivalis bacteria, which is one of the stronger bacteria in the gum. It's a high risk bacteria. It's found in pockets that are deeper. So that's kind of where that name came from. It's the weapon that it uses. And of course, gingiva means gum. So it, yeah, it's an interesting name. So to say.
That really is interesting. So is that the only thing at 2020? By the way, this year 2020, started off. It kind of reminds me of when your dentist says you need a filling, and then it turns into a root canal and a crown, and then an extraction, and then an implant. It just keeps going and going. But is Alzheimer's the only one where people are using the causative word instead of the correlated word right now with perio
I would say so. Yeah, the
for
rest.
for a disease?
Yeah, I would say so. The rest of them, you have with strokes, you have a 2 times higher chance of getting a stroke. It's been again correlated with 5 different types of cancers, usually the more aggressive cancers. Yeah, I would say the rest you can't say, the causative.
But with so what would you call it with COVID-19?
Again, this is early. This is we're calling this a point of starting point of further research because again we know we're connecting the dots in this paper, but by no means we're making any conclusions or any definitive statements here. Again, there needs to be studies where they take certain people that have gum disease, check the people in the hospitals, check their serum, see what their IL-6 levels are, maybe get in there and do cleanings on some of them, see if their IL-6 levels go down. Studies need to be done on this.
Congratulations on that paper. I read it. Now it's going to be published in the CDA next, right?
Yeah,
Is that?
yeah,
Uh,
the California Dental Association Journal in October, their issue. They're going to have a specific issue just on COVID articles.
oh, is that right?
Yeah.
I posted that article. So, by the way, if you want to beat the CDA, congratulations getting published in the CDA. But we published that on Dental Town. It will if you go to mouthcovid.com. Whose name is that? Whose website is MouthCovid?
So this is a website I made so that I can get this information out.
Nice,
I,
nice.
I
MouthCovid.
yeah, I want to make sure that people can get this not after the pandemic is done or at the end. The sooner we get it out, even if one person can get helped and have less inflammation and not go down that pathway, then it is a success for me.
Well, tell my homies,
Yeah,
most everybody that sends me an email to howard@dentaltown.com says they only listen to me on the commute to work
yeah,
or on the treadmill.
yeah.
So they're driving to work. So if they go to mouthcovid.com right now, they'll crash their car and maybe kill someone.
Yeah.
What is the gist of the article at mouthcovid.com?
Okay. So it's a very detailed explanation using literature. About 130 articles are cited, showing the different pathways that actually the can affect from this moment the virus comes into our body and how it gets to the lungs. And I'll name a few. For example, you have the saliva. You have the virus can get into our saliva, which is my next article that I'm writing on right now is the saliva as a reservoir for viruses and so we're going to be talking about mouthwashes and whatnot. But you can swallow saliva, and that bacteria again goes into your stomach. There's certain bacteria that can evade the acids of the stomach, such as P. gingivalis. That's one of them that can do that, and it can cause a gut imbalance or dysbiosis, as they call it, and that could lead to one pathway where the body gets affected. You could inhale or aspirate the virus going directly straight into the lungs. And IL-6, when it gets into the lungs, it does a few things just directly. It'll decrease the gas exchange flow. Uh, the lining of the lungs, it will deteriorate. It could also, as far as the other pathway now, you can have bacteremia. So you have bacteria going through the bloodstream. That bacteria can go again, causes what we call endothelial dysfunction. So inside the lining of our blood vessels, all of a sudden you'll have the ability, or the inability, I should say, of those cells to dilate the blood vessel. That's the same pathway that atherosclerosis happens. So you'll have that with bacteremia, which again, everything is in the body circulating. You have 60 beats per minute, and that blood is pumping, and the bacteria in the mouth reaches the foot in 1 minute. So you really have, the body's connected. And my goal is also to kind of tell dentists we need to be talking about this with every patient. We're Doctors need to step in and become a little bit more like dentists, and we need to step up and become a little bit more like doctors. And one of my missions and goals is for doctors and hospitals to actually check their patients' gums, especially when they're dealing with inflammatory diseases like lupus, arthritis, diabetes. Uh, they got to be looking in the gums. And how much is a probe cost, Howard? What would you say? A probe?
A probe?
Yeah. How much does a periodontal probe cost?
$25.
Exactly. Imagine every doctor has one. They open it up, they can sterilize it, get a plastic one, a one-time use one. Check the gums.
I got so many questions rolling through my head. Back to that probing technique.
Yeah.
The one thing I want to tell the kids is that, if you're in dental school or you're under 30, everything takes so much longer than they said. I mean, when we were in dental school, they kept telling us that, within a year or two after we graduate, there'll be a vaccine for Streptococcus mutans and P. gingivalis, and there won't even be cavities or gum disease. Now I've been out 32 years, and that's why after 32 years, when everybody keeps telling me about this COVID vaccine around the corner, I'm like, okay, yeah, I'm not going to bet the farm on it. I bet the best case scenario you can ask for is about a 50% effectiveness. I bet it won't even work on half, but that's all another story. But we also were told that probing was going to go away. First they had the Florida probe, where that was going to be an electronic measurement. And then they started talking about an ultrasonic, that we wouldn't even probe anymore. We would just scan ultrasonically, and that would map out the difference between bone and soft tissue.
Yeah.
And from the business of dentistry, it's very expensive when you have a $40 an hour hygienist, and when she wants to do the full mouth probe, she calls in for a $20 an hour assistant. So now I've got $60 sitting in that room while they're doing a cleaning, and the Delta fee for a cleaning is we're not even going to cover those two labors. So I've been ranting enough. I'll let you jump in.
I hear you. It slows everyone down, and that's one of the issues that I see, and that's one of the deterrents that really makes people not want to probe. So what is an answer for that? Which I don't think could happen, but what would be an answer if they could really make this happen is, what really matters is the most deepest pockets, or 5 millimeter pockets or more. So who really cares if you have a 2 millimeter pocket or a 3 millimeter pocket or a 4 millimeter pocket? Not much of a difference. I don't think there's really much we can call it, really a 1 millimeter pocket, but there's no real difference between a 2 and a 4. So if we could just say, throw away the 2, the 3s, and the 4s, let's go in, do a spot probing. Let's find the 5s. Let's find the bleeding. Bleeding is bad. Bleeding means that the body is sending cells to go fight. There's a war that's being sent. The freeway of the body to send the soldiers is the blood. And so it's got to send the cells. And so that bleeding is not good. But again, people usually don't floss. You have to ask these key questions. Do you floss? 27% of people lie to their dentist that they floss. Only 30% of people actually floss. So we're not getting, most of the people don't floss, basically.
I just want to know what percent of my grandchildren lie about flossing to their dentist. Of the six grandkids that tell me they floss daily, what percent of them do you think are lying? Yeah. I don't trust the 1-year-old, the 2-year-old, and the 3-year-old.
But they don't need a floss. Their teeth are spread out. They got primary.
So this must be confusing for you, because you're in Beverly Hills, where all the women think a man with deep pockets is good, and you're trying to say that that's not true. What do you tell these women in Beverly Hills looking for deep pockets?
I say, stop gold digging and start digging for plaque.
And it didn't help our cause at all when the New York Times had to publish an article that there's zero research on flossing. When you read that, did you have a heart attack or did you just trip and fall down?
Stroke.
Stroke? And how do we give these young kids some wording advice? I mean, when you just walked out of dental school
Yeah.
and a 70-year-old man with a liver spot says, don't you read the New York Times? There's no research on any of that crap. What would you tell that old man?
So I think if you want to be constructive for some of your viewers, I want to just give a couple of tips on how to explain periodontal disease to their patients, because I think that if we can deliver this message to our patients effectively, then you can link it to, you can say, with COVID and everything, and you may not even need to talk about COVID, because they want to make sure that they're healthy for them, for their heart, for their lungs, for their, to prevent cancers, all that. So the key thing that they need to start with is they're talking to people they don't know, for example, that this tooth is in their jawbone. Okay, that's what's holding their teeth. Some people don't know that. Now, when bacteria comes in, you have millions and millions of bacteria. Some are good, some are bad. The deeper it goes underneath, the worse these types of bacteria are, and the more toxins they release, the more weapons they have. The more weapons they have, they are able to get further deeper, and they can break down the tissue, the gum. They can break down the bone, and again, there is not that many nerve endings in the bone. Patients need to know about that. That's why only 6% of really gum disease patients feel any pain. So it's a silent disease. So they need to hear that hey, I already know you're not feeling pain, but you still have a problem. They need to hear that. The blood in the gums goes all over the body. In 1 minute, it reaches the foot, and you have toxins and bacteria spreading throughout their body, going to different organs. So once they kind of hear that, then they're like, you'll get their eyes open, and they'll say, okay, I kind of get this. And people, for example, people who get chest pain and angina, and the doctor says, put this underneath your tongue, the dilate, the blood vessels. How long does it take? The reason they say put it underneath your tongue is because once it crosses that thin tissue, it's going straight to the heart. So the body is really connected, and once dentists really believe that and understand that, and they can convey that with passion and care to their patients, it's a game changer. Howard, it's a game changer. I talk about the periosystemic, the mouth-body connection with every one of my patients. They are so appreciative. I have a higher value of in their mind. Now, I'm no longer a dentist. I'm caring about their whole body, and it's we take their blood pressure. Wow, that's another wow. We talk about what vitamins they're taking. I talk about with them. They don't know what vitamins to take. They don't know what cytokine storm is. That's how people die. I talk to some patients. I say, you know how people die from COVID? Like, no, it's the lungs. No, it's inflammation. They don't die from anything other than their body's reaction to it. And so the sooner that they can take care of that inflammation, the better. And that's why people are proposing now. There's a lot of research going into nebulizers or breathing in asthma steroid medication, so that you can put out the fire and decrease inflammation right in the nose and the mouth early. Why put out the fire when it's jumped over the freeway and down the street when you can go right to the source? Or, for example, there's people working on IL-6 antagonists. If IL-6 is what's killing people, and that's the predictor, why not give an arthritis medication that blocks IL-6? It's already a couple dollars. It's called tocilizumab, and they're showing that the people who get that have a 90% decrease in dying. 90%. So all this is happening. All this research is happening, but it's not getting any news.
You just reminded me. You know what I always have in my upper pocket here is the
What?
my nitroglycerin pills. So I'll take the nitroglycerin pill. My gosh, when I hear smart guys like you, I mean, you started two research journals, I guess in dental school, and they're still going strong, right?
Yeah.
You my gosh, let me see. Oh. Where did I put that? Oh, he is the founder of both the UCLA and USC Journals of Dental Research, The Explorer.
Yeah.
And my gosh, your mind is amazing. I listened to you on YouTube. I think for about 3 hours with Arash, and
Mhm.
my God, I think you got more brain in your small finger than I have in my head. When you look at this, so I'm always curious. The pyramids were 5,000 years ago.
Yeah.
We're here. The species is 1 million years old, but there's really no sign of it until about 5,000 years ago. When you're digging deep into this, I know you can't be aware of anything above our comprehension, but do you think we're 1,000 years from knowing how this whole body works, or do you think it's more like 5,000 years?
I
I
don't
mean, do you
think
think
we're ever gonna ever fully know.
that we're never gonna understand the whole body? I mean, all
Well,
these
well,
gingipains and
we're,
IL sixes and
of course, we're gonna get a lot more sophisticated and know more and more and more. But for example, the brain, just the brain, we probably know like a fraction of what's really happening in the brain.
so, what is your advice? I'm going to say on COVID-19 just because it's what everybody's talking about. But by the way, I have an interesting theory on from Dental Town.
Yeah.
We started in St. Patrick's Day '99, so it's like 21 years old. When before COVID-19 broke out, there were 5,000 jobs listed in the classified ads and 1,000 practices for sale. Now there's 2,000 practices for sale, and there's only 1,000 ads for an associate, and all of those are DSOs. I mean, they're the only ones hiring. So, to the guys who all want to throw mud under the DSOs and all that kind of stuff, it's like, hey, they're hiring the kids that come out of
Yeah.
school. When I was little, that was only the Army, Navy, Air Force, Marines, Public Health, Indian Public Health Service. So thank God someone's employing those people. But Dental Town's always all clinical dentistry, and then it went to all COVID-19.
Yeah.
And now what I'm really excited about is it's back to about three-fourths dentistry. You're out there in California.
Yeah.
Do you think if it gets a little more out of hand, do you feel that you may be closed down, or do you feel that the government of California sees you as an essential service, no different than a hospital? I mean, like when I go into, they've closed the bars down in Arizona, which if you're Irish, I think that's like anti-religious. I
Uh-huh.
mean, you can't close down
Yeah.
a bar for an Irishman. That's like closing down the church. How could they close down the bars and not the churches? Does that make any sense to you?
No.
But are you worried that
Mhm.
you may be closed down again, or do you think we're past that?
I think we're past that. So I'm actually very optimistic about the future, and I'll tell you why. Because and it's not as much with vaccines. It's more of I believe that we have this immunity that is that's innate, right? We have the T cell immunity, and then we have the B cells. They were only looking at the B cells and the antibodies. So that's why when they saw the antibodies starting to go down, they basically were scared and they said, "Oh my God, there's going to be reinfections and whatnot." But now they're seeing that we have this T cell immunity that is pretty high, and that's why we're not getting, we're seeing this dip in certain places. So, for example, in New York, you'll see the chart of New York and the number of deaths really going down because whoever would have died, a lot of those people have died. You have the older people, you have certain populations, the obese and the certain minorities that were, so a lot of people who would have died, and the people who have strong immune systems may have not even known they got it, and you can't even really test yet whether they had it or not. So the we are closer to herd immunity than we actually think we do. So I think we are out of this not fully, because there's not going to be one day where all of a sudden you're going to see a mission accomplished banner up, but you're going to see in the next 3 months this thing fizzle away.
The
And
next 3 months?
two, maybe even, I think 10 weeks, and 10 to 12 weeks, and we've seen this thing fizzle out. Now, not everywhere in the world, because some places are got it a little bit later. Some places were really um, cracking down early, so they didn't get the surges till later. But overall, like you look at London, London was surging, now it's down. Italy that was going wild and crazy, the hospitals and ICU beds, and you barely have people going into the ICUs now there. So that's the characteristic of this virus. This virus hits, when it hits strong, it spreads fast, it gets who it's gonna get, and then it starts to fizzle away, and then it's gonna go away. I don't, and
So you really think the worst is behind us?
I do.
And do you know how much guts you have to be saying this on a video? That's, I mean, your words are. I mean, you're not saying this at a bar to some hillbilly. You're saying this in video and print. I mean,
I'm saying this in video. My article is also written on print and may get criticized, and the truth eventually comes out with time. So I
so do you feel like, I mean, does that scare you? One of the reasons I want to ask is a
yeah,
lot of dentists are introverts, and they're
yeah,
always so shy, and like you do a podcast with them and they're all afraid they're gonna say something or they want something edited out or
yeah,
whatever. I don't know why they even care. I always explain to them, it's like, look, Homo sapiens 1 million years old.
yeah.
For mitochondria Eve, 120 billion of them are dead. Who cares what other people think? But or do you feel like a stockbroker calling the next recession or change in the market, and you just really feel confident you're right, or do you have any did you have any inhibitions that, oh my God, I can't? What if I'm wrong? I mean, I don't want to be sitting here this time next year and everybody saying, oh, there's that periodontist who called the end of the recession or the coronavirus outbreak, and he's
Yeah.
so wrong.
Uh, I listen to smart people. I look at the science. I don't read. I don't listen to the news. I'm looking from article to article to article, and then I'll go into that article and I'll see who they're quoting. That's all. That's what I'm looking at. And then you have to know which scientists to listen to, and so from the treatment aspect of this disease, again, this disease is not, again, Howard. This disease is not going. It's not leaving us. Okay, so I'm not saying that there's a cure, and there may never be a cure, and it may always be with us, because the only disease that has ever been eradicated from our population has been smallpox. Everything else we've managed and we're dealing with, but it's background noise. So that's what I'm saying. That we're going to be able to deal with this. And what I'm saying is that we may get to a point very soon that we may not even need to rely on vaccines to make us feel comfortable taking off our masks in public.
Okay, this is so groundbreaking. I want you to say it again. Give the explanation again. You were talking about passive immunity versus active immunity
Yeah,
versus innate immunity versus
yeah,
immunizations.
yeah.
Go back through that succinctly, because they might have just driven off the road into the
Okay.
ditch.
All right. So when you get an intruder into your body, bacteria or virus, your body already has these soldiers ready. Those are the macrophages and the neutrophils. They're there. Okay. So COVID is very smart. It secretes an enzyme that camouflages itself, so it can replicate a little bit longer without you even doing anything. Okay. So now they're looking at
And
uh,
were those macrophages, that was the innate or adaptive? What?
innate.
That
Innate.
was the innate.
That's the first line of defense. It's already present. Your body doesn't need to make it. They're swimming around your bloodstream, already ready to eat. They're eating. Then your body then could makes T cell. The T cells then make other cells, CD4 cells, CD8 cells, and these cells then come, but they need a little bit more time. and sometimes they take a couple days. Then they go and it's called the demolition phase. So they're going and to demolish everything. Okay. This is Howard. This is why that you're seeing children not get problems because children already have coronaviruses all the time. Their bodies are have these these T cells immunity. They already have it. They don't need 2, 3 days to make it. We do. The older you are, the more days you need to be making these T cells. B cell is the cleanup phase, or they come in and they have the memory. So that's what we've been focusing on so far, the B cells and the memory and that aspect of it. And we're seeing that when people get this disease, that there's a drop off in the antibodies in the body. So that's why people were freaking out that I got COVID already one time, and now I could get it again. But with a few exceptions, and again, in every disease, every problem, you're going to have exceptions to every rule. But and people are going to say, no, well, well, Fauci might come on, or someone will come on and say, well, yeah, what about these 5 people? They got reinfected. Well, show me the proof. First of all, how do you know they even got it the first time? But show me, and then so reinfection may not exactly be happening or an issue because of the T cell immunity.
Wow, this is amazing. So what are you actually succinctly predicting, that the worst is behind us and this will be a lot easier in 90 days?
Yes, I am.
How would you say that?
I would say if you look at the wave, we and again, I don't look at the testing, the cases, because the
Right.
cases, uh, who knows? You had in Florida, they were saying that 90%. So we can't look at that. You have to look at hospitalizations, because no one wants to go to a hospital unless they have an issue, and even deaths. The Some might be skeptical. If they got a car accident and they had COVID, they put it down as a COVID. But you have to use it, but not rely on that. That those charts. But the charts are all showing that right now we're kind of in a little dip again. So things are kind of getting better. I see that coming down. I don't see it doing one of these again. I see it fizzling, because again, you have to look at the other models like Italy and New York. They just went through it. They got hit hard. They got hit fast. Some places they had good contact tracing. They were shielding people, so their curves are a little bit weird because it was controlled. But you really, you got to look at Sweden, because Sweden, they were very bold, and they made I think what turned out to be a wise move. And again, you will tell with time that they didn't ruin their economy. They didn't stop anything. Again, I'm for masks. I think that that you got to be really tight on masks, because that's how this is a respiratory issue, it's things are spread through the respiratory droplets. So, but I think you're going to see that one of the big winners is going to be Sweden in the long run. You, I'm a long-term thinker. I don't think about short-term. So again, that's why I think like 5 to 10 years from now. I've always been that way.
What letter grade would you give of Sweden's response to the outbreak versus Italy or New Zealand?
Yeah, I don't know if you can give an A to anyone, because we're in it. When you're in it, you can't really grade, but we'll see. Sweden might be getting like a B plus. I think that the if they have someone again, people, this is survival. People that have issues and conditions that make them more vulnerable, then they are going to have to take responsibility for their life and stay home and be more careful. But the people who have stronger immune systems and want to go to school, you know, it could be responsible. Now, I'm not for concerts and clubs right now either. I'm saying, you know, we didn't have to exactly perhaps stay home for a few weeks, because bacteria and viruses, they really are, they are our immunity. They are. They're part of our immunity, and we have it. They don't go away, and they've been around for much longer than humans, and so uh, I don't think we should be afraid to be able to get these the bacteria from other people.
So the number I was watching is deaths obviously and recovered cases, because when they say on Worldometers that there's been 20 million cases, well, come on, there's almost 8 billion people. I mean, that's a very small sample. But I like the deaths versus recovered, because if you look at the 13 million recovered with 740,000 deaths, that's a 5.5% mortality rate for people, and these are people that are seeking care. So
Yeah.
we don't know about the people who got the COVID and the corona and didn't even know it or thought they had a cold or a flu. But if those who seek care, it looks like it's about a 5.5% mortality rate. But if you go back to March in New York, I think it was more like a 7% mortality rate.
Yeah,
I mean,
it was, yeah.
so I don't think all the old guys like me, I don't think would care if they just knew that when you went to the hospital you weren't going to die. If they could do something
Yeah.
to keep you alive. I don't care how nasty the flu is, as long as you don't die. But
Yeah.
do you see that? But do you agree that like New York was more closer to like a 7% mortality rate? It's drifted down to maybe 5.5%, and these things that you're talking about, like the nebulizers and all these different mechanisms. Like Jim Glidewell told me that he was in when he went to the hospital. I mean, I think he's the most famous person in dentistry that's actually had this disease. And he served a year in Vietnam at a high school, and he said that was the worst 17 years of his life. I'm like, come on, Jim, you were a year in war. And he said, no, this is worse, because you're just staring at the ceiling for 17 days knowing you're going to die. But he said it was when they brought, when the remdesivir came through.
Yes.
And he said they came in, they told him they got some of this,
Yeah.
and they started giving that to him, and he said that's when it all broke.
So I want to talk about that actually. Let's talk about just a couple of treatments. So early on, you want to first take an antibiotic like a Z-Pak, okay, so you don't get the pneumonia, okay. Then you want to do if you can get a nebulizer, that's the time when you want to put out the fire over here, right in the mouth, okay. Again, the virus comes into the nasopharynx, goes down the throat. This is where you want to open up the bronchioles, and you want to decrease inflammation locally. Then it goes into the next phase, which is when the virus starts really replicating, and so vitamin D, you have to take your 5 to 10,000 milligrams of that, zinc 50 milligrams, vitamin C, turmeric has lowers inflammatory cytokines like IL-6, so you want to be taking all of that as well.
Name those four again. Zinc 50 milligram, turmeric.
Turmeric, like I do 1,000 milligrams
of turmeric.
Yeah.
Okay.
Vitamin D3, 5,000 milligrams. This is by the way, this is all daily. And then if you get COVID,
vitamin D3, 5,000 milligrams
on a daily. But if you get COVID, I would up it to 10,000 milligrams.
Okay.
Okay. Vitamin C, 2,000 milligrams. Then again, get your cleaning. You got to tell your patients, like, this is the time when you want to go for the deep cleaning. I know you don't like to get numb, but let's numb this area and go a little bit deeper this time. So this is the time when you want to decrease inflammation. By the way, Howard, do you know that IL-6, it gets increased in people who have processed sugar and processed carbohydrates? So elevated. So this is the time when you want to decrease sugars and processed carbohydrates.
But but go back to that nebulizer again.
Yeah.
Is that okay?
Yeah, the nebulizer, and this could be like, for example, in the future, if we're gonna have to live with this, maybe everyone in their house already has one of these masks that they breathe in, budesonide, which is a asthma steroid, and you just breathe it in, and it will decrease inflammation locally. Now, late in the phase, when people are on a ventilator, okay, so again, the whole goal is to be out of the hospital and not let it get there. But if people get onto the hospital, they usually go to the hospital because of trouble breathing. When you have trouble breathing, that's when a lot of times that they want to start giving the dexamethasone. That decreases inflammation systemically, but it also lowers the immune system. So, not the, of course, and it helps. It helps people who are late in the game, um, you know, but not on a ventilator yet, and it helps decrease the chance of death by 30%. So dexamethasone will decrease when you're in the hospital. When they give it, it's been shown to decrease mortality by 30%. When people get on a ventilator, that's when you give remdesivir. So remdesivir is last resort, and that's also been shown to help people be able to breathe better. Early in the pandemic, we were seeing people on ventilators. Only 20% of them were living. Now we're seeing that number jump to 35%. So the treatments that are now available when people are on a ventilator have gotten better, and so we're seeing less death.
And when they start doing the ventilators, they had it even turned up too high, things like that, that you read about. I want to talk about this also. You know that diabetes is a pre-existing condition that can make it worse. Now you're hearing people say that if you think you're coming down with it, you should immediately stop eating all sugar, go paleo,
Yes.
and go to what is that called when you ketosis, the ketone
Yes.
strips.
Yes. Ketone.
Is that because when there's glucose in the blood, is that feeding the virus, or is that what? Is it because is that smart to just like go paleo and go into ketosis if you think the coronavirus is breeding inside your body,
So
or is that
it,
not correct at all?
I'm not sure. To be honest, I'm not sure the mechanism exactly. I do know uh, that people with diabetes, their blood is not flowing, and that's why dental implants fail more, and all sorts of, and blindness. Blood is not flowing as well, and you have to think of it like a freeway. Our blood vessels are like freeways. Smoking takes up one lane, diabetes takes up another lane, obesity and these fatty plaques take up another lane.
Please tell me this is an 8-lane interstate.
I'm hoping so, for everyone's sake. But and when we have an emergency in a car accident, we need the ambulance to be able to get there fast. So that's what sugar does. It takes up a lane, maybe 2 lanes. I don't know, but it takes up a lane. And so we want blood to flow. That's the key to life. We want oxygen to reach areas. We want our body immune defense cells to go to places quickly to recover. And that's part of the inflammation. Inflammation is okay because it's part of the healing process. So um, I think the real answer to your question could be that sugar, again, sugar is one of the body's enemies, in my opinion. It's one of the worst things for us. I myself, and I've tried to practice what I preach. Myself, I've pretty much cut out processed sugars. I just have like the fruits, and I used to love. I know I'm a dentist. I used to love Sour Patch Kids and gummy bears when I was like in dental school. That was my thing. I don't know. Go figure. But I can't have it anymore because I know how bad it is for us.
I feel bad. I mean, there's so many things I can talk to you about, and one of them is, my gosh, I mean, you're the co-founder of Synergy Specialist, where everybody talks about you on Dental Town about traveling specialists. I just want to make sure, but your COVID-19 material is so stunning. So To just be more succinct, just to hold your feet to the fire.
Yeah,
First of all, can I ask you a personal question? Do
of
you have
course.
children?
I do. I do. I have two little girls.
Okay, so you know the value of children. If you would you want the governor to open up the schools in California and send your kids back to those schools, or
Absolutely.
not with your girls?
Absolutely. Open up the schools. Absolutely.
So that's just part of the natural immune process.
Yeah. Well, with kids, again, the studies have shown that they're not giving it to the adults. They're if they get the virus, their T cells are there fighting it pretty quickly. We have to protect the teachers, of course. So teachers have to be, I'm for them wearing masks, protecting themselves in school.
The teachers wearing masks or the
Yeah.
kids?
Uh, you know, so in this my own kids' school, that when they start, they're gonna have to be wearing masks too. But it's gonna be difficult to fully get them at all times to be covering their mouth and the nose, and that's the reality. But at least the teacher, they're getting see-through masks for the teacher, so at least that they can the kids can see them smiling in their emotions, because that's so important in being able to interact and connect with people.
So, is there anything else you wanted to say on COVID before I switch subjects?
No, just basically that things are going in the right direction, and I've been watching it really carefully every day, and this is uh, when this whole thing happened, I said, how can I use my field and my knowledge to be able to make an effect and help the world, and somehow, and this is what came out of it. So um,
So, what do you think of, of Fauci's response? I mean, obviously, when you go back through history, I mean, when you're in the middle of a World War I or World War II, your most famous generals you can think of
yeah,
definitely had huge sections of America that didn't agree with the thing he was doing, right?
yes,
Everything is controversial, everything is polarizing.
yeah,
What kind of letter grade would you give Fauci, or critique of his response?
yeah. So I am he has a tough job. Okay, he has a tough job. Let's put it that way.
The
So
largest
he,
understatement of 2020.
he's it's very difficult for him to win, right? Because again, you called it. We're in a polarized state. You don't have too many people in the middle that are going to be like, I kind of like him, or I know today I don't like him. It's either you love him or you don't. That's what's happening right now with everything. Um, with Fauci, again, I am skeptical, okay? Because number one, everyone should be skeptical of everything right now, I believe. Okay? It should be your radar should be on as a human that's trying to survive in this world. Your radar has to be up, and you have to take everything for you have to investigate everything, because you have to find out what's their interest, what money is at stake, who owns what, fact checking websites, who owns them, um, you know, so all of that stuff. So you have to be, and then Fauci's not elected by anyone. He's had his job for 40 years. So again, he's made a couple of mistakes, as so did everyone, especially Trump and everyone. Everyone's makes mistakes in this pandemic. There's no one that's perfect, but uh, when you came out and said, for example, hydroxychloroquine is safe 15 years ago, and then all of a sudden you're saying it's not safe, that's you got to be suspicious. When you say that masks, no one should be wearing masks, and then you say, of course you should be wearing masks. So these are things that make me say, okay, I don't believe anyone, and I need to make my own judgment. And again, it all goes back to common sense. Let's get our common sense back.
Yeah, this has been the biggest shit show I've seen in my life. I mean, I turned 58 this month,
Yeah.
and I lived through
Absolutely.
I thought the the 80. I graduated from high school in 1980, and the 81 recession. I mean, it was 21% interest rates. It was
Yeah.
double digit unemployment. I mean,
Yeah.
I thought that was the worst, and I thought it was really good for my childhood too, to
Yeah.
leave high school and go to college and realize you better save for a rainy day.
Yeah.
And just because everything's really good
Yeah.
you live through when it's really not.
I agree.
That was the big example of all the elderly I knew
Yeah.
that had served in the wars that were older than me, Nam, Korea, and all that stuff. As they go, don't you can't take all this stuff for granted. But I'm going to switch subjects, and I hope you're right. My gosh, I hope you're right. That would be so cool to have this starting to get behind us. But let's go to something else that you're very controversial about, and that is, everybody, humans are all territorial. I mean, when I let my dogs out in the morning, I mean, the first thing they do is they'll pee in their favorite spots, and then they're
Yeah.
marking their territory. And every specialist wants his own land, his own building, his own house. And he wants to come out there and pee on all four corners every morning. And this is mine. But it's hard to get dentists to put the patient first. Like when dentists tell you they're patient centered, it's like, man, do you have a head injury? Or are you drinking? Or I mean, your hours are Monday through Thursday, 8 to 5. The Federal Reserve is the largest employer of PhD economists in the world. I think they have like 3,200, and they put out studies that show like 100 million Americans cannot go to the doctor Monday through Friday, 8 to 5
Yeah.
out of 3. So it's like, okay, just your hours alone just flip the bird to 100 million people. So if we're really patient-centered, look at retail. It used to be when in the 1950, you'd have to go to the butcher, the meat market, the vegetable, the bread man, the produce man, and the big Krogers of the world said, no, we're going to do one-stop shop. And so now look at pediatric dentistry. The number one business model that's growing the fastest is when a pediatric dentist and an orthodontist get in the same roof. Because every pediatric dentist, the mom's going to say, does my kid need braces? Oh, well, guess what? We had no idea this was a question.
Yeah.
Really? You want milk and bread? We just thought you only ate bread. We had no idea you wanted milk.
Yeah.
So you're a traveling specialist, which, when people talked about this in the 80s, I mean, it was heresy. I mean, it was like, and I think it's following 300 years of retail. Everything we learned about retail is put it all under one roof.
Yeah.
You're the co-founder of Synergy Specialist, where you actually drive in. I mean, you go to the dentist. Talk about that. Is it controversial? Do other periodontists not love you anymore because you're hurting the business model? Talk about that.
Those days are over where that was maybe 8 years ago where you would get an eyebrow raised at you. Those days are over. We get requests from periodontists who have been working for 20 years, 25 years that are looking to close down their office and make it, instead of 4 days a week, to 3 days a week. So we're helping them. They are also a dying breed. Having your own office as a specialist is becoming less of a attractive thing because of the overhead. You saw what happened when COVID happened. You had 3 months where people were sitting at home, perhaps, and you had to still pay people. So nothing happened to me during that time. I just didn't make any money. So when you're light, as far as you're mobile, you're light, you don't have a heavy overhead and expense, that's where you're going to be winning in the future. Who knows if this is going to happen again? Who knows if they're going to do shutdowns again? So there's a lot of uncertainty in the world, and so you don't want to be heavy. So I think that this is the future. People want to be, dentists want to collaborate. I do consultations. We sell cases together. We explain treatment together. I take out a tooth. They'll come in, place an implant. They'll come in, restore right away. You're not sending the patient, in the car bleeding to the oral surgeon's office and back and forth and to the dental. So it's all about teams and communication and having control in one location. Now, if a patient wants to see me and they have an issue, I do teledentistry now. So through an app called Dentulu, I'm doing teledentistry. People can call me, FaceTime, and I can see them in other offices and things like that. So I don't see any issues with it at all.
So So how does I mean I hate to be rude and crass and shrewd, but the dentists are going to say, well, what's the money? How does it financially work? Because
Yeah,
the patients obviously want everything for free. They want to come in and put down their cigarettes and their Mountain Dew and they get a free all on four.
yeah,
I get that. The dentists, they'd rather be paid $1,000 for a filling than $1. That's true. But with the when I got out of school, I just sent Delta my fees, and all the agreement was, here's the percent they'd pay. They'd pay 100% of whatever fees I submitted for cleaning exams and X-rays. Then it was 80% for fillings and root canals, and 50% for crowns and dentures. Well, that within a decade or two, that changed to, we're going to send you the fees. So they already got this fee height. The neat thing about specialists is those same insurance companies like Delta, they'll give you more money. So like DSO is already looking at the math and saying, well, if I pay a general dentist to do a molar root canal, say Delta gives me $650, and I know 10% of them are going to fail in 5 years. If I send it to an endodontist, my failure rate goes from 10% fail in 5 years to 5%, and I get an extra several $100s from the insurance company. And so then it comes down to the fee split. They hire general dentists for 25% of production. A lot of specialists, their opening bid is half.
yeah,
And okay, so there's almost no dentists that have 50% overhead. So when a specialist says, I'll come into your office for half, it's like, well, why don't you just stay home and I'll mail you a check for money? Wouldn't that be better? So talk the money of this.
yeah,
What is the business model of
yeah.
Synergy?
So you have a 50-50 split with a specialist and the dental office. So usually on a once a month basis, they'll come to the office and they'll do services. Let's say, for example, like myself, I'll do extractions, implants, osteosurgery, tissue grafts, whatever. Uh, Line them up throughout the day, consultations, treatments, and on average, let's say if I can produce, let's say $10,000, anywhere from 8,000, 12,000, sometimes more. And so the office will be, taking, let's say on a $10,000, they'll take 5,000 times 12 times a year. That's an extra $60,000 of income. So it's pretty much increasing the value right away of your office because you have increase in production. You're keeping things in house. You have more control over your cases, and then you have to think about it this way: you're also watching a specialist do procedures, so you also could learn. You know, for your easier extractions or whatever, you can end up looking and learning. So this is really it's a win-win. I really try to get involved things that are win-wins because again, I think long term, if it's only
I
in the
love
end,
what you're doing. I mean, you're changing the business model. I think the funniest thing on your website, though, I love it, is how you call pediatric dentistry pedodontics. You used to have endodontics. What specialties we serve? Endodontics, pedodontics, periodontics, prosthodontics, orthodontics, oral surgery, and dental anesthesia. It'd be nice if it was odontics, but it's so funny how the young pediatric dentists do not like the word pedodontics because it sounds like pedophile, and but anyway, so you're doing that's 2, 4, 6, 7. How many specialties are there now? Is there 10 now?
you know, we we're I probably like 10, yeah. But the bread and butter is oral surgery, periodontics, endodontics, and ortho. Ortho is a harder to implement model. Number one, because you have people doing Invisalign anyways, and Invisalign is rather easy for general dentists to set up rather. But if someone, for example, is in the middle of a case and the orthodontist leaves, it becomes a headache for that dentist. So ortho is a little bit more difficult and takes a commitment from an office. And we straight up we will explain that because we don't want to get into a situation where we're scrambling to find a specialist for that particular office.
Yeah, and that's a big problem with ortho. You're married to the case for 2 years, but I'll tell you what, orthodontists, I want to tell you something. I can give you names of dentists that are friends of mine. Some of them are classmates that got into ortho doing it themselves and just ended up not liking it, or was having a specialist come in to do the ortho, and they had a couple hundred cases or whatever. And one right here in Phoenix that I watched were three different instances where something fell through. One was, whatever, it doesn't matter. You had all these cases started, and your orthodontist that you were going to pay to come in and do all these fell through. And a local orthodontist said, I'll take all those cases and finish them for free if you give me all your referrals. And for the one in New Mexico that I'm talking about, oh my God, he's been making bank off one guy for 30 years for this. So, so the long-term relationship with the ortho, that would be kind of weird. By the way, there's 12 specialties now. Can you believe that? 12 specialties. So you do the big ones. So there's 12 specialties. Yeah. And you do the big dog ones.
Yeah.
But let me go back to the business, because this is where it's headed, okay? Yeah. So DSOs, the big problem with millennials in general, and I know when I just said that, I just got flipped off by a lot of young dentists, but, there's some truth to it, is they have real high job turnover. The older people, they graduate from college, they got a job with Hyundai, Toyota, whatever, and they work their till they're 65. My mom's brother, who lives out here where I do, Pat, he got a job at age 16 with Mobile Oil and retired there at 65.
Nice.
And the nicest thing is when he got a job at 16, there's this little checkbox. Do you want us to withhold 3% of your pay for retirement? And he just thought, oh, what the hell? So he just checked that off. Beautiful. Little did he know that one decision, he didn't even realize that was a big deal till he was like my age. And then he realized, he was a millionaire.
Yeah.
But anyway, he stayed there until 65. But now, even with the greatest companies, Facebook, Amazon, Apple, Netflix, Google or Alphabet or Microsoft, whatever, their average millennial only stays 1 to 2 years. And with dental associates, I mean, okay, if Google and Alphabet and all these companies are giving them all these benefits and stock options and pool tables and free food and all that stuff, and they love it, but then someone will walk up to you and say, what are you working on? And they'll say, oh, I'm working on this. And they go, well, I'm over here working on driverless cars. You should quit and come work with me. They're just jumping.
Yeah.
So they're jumping all around, and to retain them, companies like Heartland will say, well, if you come work for us, we'll give you all this CE. And the two biggest drivers are, I want to learn how to place implants or do clear aligners. So they come in and you spend all this money taking courses. They start placing implants on your deals, and then they're gone in a year or two.
Yeah.
But 5 years later, guess what's happening to some of those implant cases? And you're getting out your checkbook and sending them to a periodontist to redo the stuff. And the same thing with molar endos. I mean, people don't talk about it a lot, but when root canals fail, and they go to, and by the way, the whole court system's based on the specialist, because if I break off a file and the root canal fails, I'm a bad dentist. But if an endodontist does it, well, he did the best he could.
Yeah.
He tried. He did it. He's the most qualified. So a lot of DSOs have already reached the point moving forward. I don't want general dentists doing my specialty work. I want him doing basic work, because I'd rather have an endodontist come in. And here's the deal about the 50%. You say it's 50%, but 50% of what? I mean, the insurance companies are paying the endodontist a couple hundred more on a molar than a general dentist. So it's actually more profitable. If you have less failures, you have less chance of going to the board, less lawsuits, less warranty work. Yeah. So you have higher success rate. The insurance companies are really causing this because they're paying specialists more. Yeah. So let's take the root canal, because they don't know all the perio procedures, but a molar root canal, when your specialist doing it, when they go into an office and do it, what would Delta of California paid the general dentist to do that molar root canal? What would they pay the endodontist?
I don't know the exact numbers, but I know it's a few $100s more.
Yeah. So if you're getting paid a few $100s more, that's the difference between I'm paying you 25% versus I'm paying you 50% versus I don't have to worry about it failing half as much.
And quickness, possibly less post-operative sensitivity. Higher perceived value from the patient, because now you have a multi-specialty office. You have a team. People like teams. They don't like one-man shows. So all of that, and you nailed it with all of the points that you said. This is it's not the future anymore. It's the present. It's such the present, so much of the present that there's so much demand for people in dental offices trying to bring in specialists that the market has changed such that uh, not every dental office can even qualify for it because you have to now have a certain flow. Certain, you know, you can't just say, oh, we're going to cancel today. You have to have some sort of uh, some specialists may have a minimum, for example. So the it's the present.
So, and of the 12 specialties, what is rank them by demand? What's the ones that everybody's saying? What is Synergy making bank on
Yeah, good question.
and staying busy with?
Yeah, I've always wanted to talk about this. No one's really asked me. So yeah, probably the as far as specialties, oral surgery is by far I would say the most lucrative. Okay. Um, then I would say endodontics.
Lucrative for Synergy, the dental office,
Both,
the dentist bringing them
both,
in, or the
both.
specialist going in?
Everyone, because you have a higher production that day.
My
You know?
gosh, you know what, when in Arizona, if you come out of oral surgery school, and by the way, oral surgery school, I know successful people. I mean, they don't take no for an answer. I mean, and you didn't get accepted to specialty school. I know oral surgeons who went down to the Caribbean to become an oral surgeon, but when they come back to the United States and they get their privileges, because the hospitals, the insurance companies, are you board cert, or you a specialist or not, they don't care what school or country you went to. And my gosh, their base salary is $350 upon graduation.
Yeah,
I mean, you just graduate from oral
yeah,
surgery school, your base pays $350.
yeah. You do IV sedation, a few $100s there. You're taking out wisdom teeth quickly. Usually, oral surgeons. I'm impressed. They can take out these teeth pretty quickly. So they can do multiple an hour, and if they get the right office that can manage the moms and the patients and the flow and the post-operative care, and you need a good 2 to 3 assistants for that oral surgeon. When done properly, they can be producing $20,000, $15,000 to $20,000 a day. And so that's in the summer it could be more with oral surgery. So oral surgery is number one. Um, Endodontics, what I was saying, is number two, because
Oral surgery is number one and orthodontics is number two.
no, orthodontics is last.
Okay, oral surgery is number one
Yeah,
and orthodontics is last.
last. Yeah,
Okay.
I'll tell you why. But number two, I would say, is endo, because it's such an easy thing to diagnose. There's not much of a consultation, you know, except you have to just confirm that there's a retreat or root canal needed. Um, and we're seeing less and less retreats, by the way, be done.
Less and less retreats from endo.
Yeah,
Why is that?
the predictability of implants I've seen has been
Oh, so you're saying retreat endos is going down because they're not retreating them; they're just yanking them and placing
yeah,
titanium.
yeah. Whether it's correct or not, I'm not saying. I'm just saying we're seeing more diagnosis and treatment plans pushing towards less retreats.
Okay.
And apicals and things like that.
Yeah.
Unless you see it was a poorly done endo to begin with, they may have missed a canal, the CT scan was taken, the patient doesn't want to take it out. Of course, you have all of those, conditions. But overall, I'm saying, perio, we see number three. Although perio could be number one or two if done properly, and I talk about that in some lectures of how to get perio to be a booming part of people's practices. You really have to focus on osseous. We have to be looking at pockets that are 5 millimeters or greater. Probing, like I said, we got to get the probe in there. Probing is done incorrectly, Howard. You know that a lot of probings are done incorrectly. We're not using the correct probes to check for furcations. We're not checking the distal of number 2 and number 15 to see if there's a furcation there. The probe could be angled. You have to angle it sometimes to see what's going on deeper. And all of a sudden, you'll go a little bit deeper. It's not that you're pushing too hard; it's that it's going in deeper, and then that's why it's bleeding. That's what's causing perhaps the earache or the headache on that patient. Or so probings aren't done 100% correctly. Uh, so osseous surgery, tissue grafts. One might say, like, most people have some sort of gum recession that are above the age of 35, 40 years old. So whether it needs to be done would be the judgment of a periodontist, but they're not even getting that opportunity to even examine the patient.
But the patients ask the best question, and they're going to say on the recession, that abfraction, they're going to say, okay, but if you don't fill in that abfraction, you don't do a gingival graft, if you don't do any treatment, what's going to happen to that abfraction and recession? That's what they're going to ask.
The longer we wait to take care of it, the harder it is to fix it. The more bone that's lost around the tooth, the less blood supply there is to give chances of growing it back. So the earlier you intervene, the higher the chance of making things back to where they once was. Not if some people are okay with aging and getting longer teeth but you can't assume. So you what that patient wants. So you have to give them the opportunity for them to make the decision. Let them say no, it's fine. No one's forcing anyone to do anything, but let's have that consultation with a specialist. Let's see what's going on, and perhaps we can make things better, and perhaps maybe it's not for you. Maybe it's not right at this moment. If maybe it hasn't gotten worse in the past few years and it's asymptomatic, maybe we could watch it. Let's take a picture and see where it is. Let's see how much keratinized tissue we have. Let's see how thick the tissue is. There's all sorts of diagnostic and tools. So that's kind of where my take on that is. The perio, if done properly, could be really good.
So you're putting that at 3, oral surgery 1, endo 2, perio 3.
Yeah.
And then what's 4, 5, 6, 7? We got to go to 12.
I don't know about the end ones, but I would say then
pediatric dentistry. Yeah, I'm the guy who said pediatric dentist. Yeah, he's the guy endorsing pedophils.
The word pedo anymore.
Then what would be next? Prosto? Or dental anesthesiology? Dental public health? Oral maxillofacial pathology? Oral maxillofacial radiology?
Yeah. Radiology, pathology. Put those all towards the end, because and even anesthesiology is that's probably one above ortho, because
what's one above ortho? Anesthesiology?
Yeah, I think that's a great field as far as
but you're saying it's next to last. You're saying the most popular is oral surgery, endo, perio, and you're saying the bottom is orthodontist coming in.
Yeah, the more surgical procedures you do in dentistry, the more production and value usually.
Okay, class, did you hear what he just said? What has Uncle Howie been telling you for 4 years on this podcast? The average oral and maxillofacial surgeon in the United States makes $448,000 last year. Average periodontist $330, endodontist $307, pediatric dentist $304. The minute you drop out of pediatric dentist, you're in a non-bleeding ortho. You're out of the 300. You're in a 289. The average dental specialist makes $320. Average general dentist makes $197. And the average general dentist who owns his own practice makes $244. And if he works for someone else, it's $147. So what have you learned? If you learned anything from what I just said, if you graduate with $400,000 of student loans, don't get married, because marriage is the number one cause of divorce, and your divorce will be $1 million plus. Number 2, if you own your own practice, you make $100,000 more than if you're an employee. And blood and guts is far more valuable than soft and pretty. I go into dental schools and people say, I want to be a cosmetic dentist and do bleaching, bonding, and veneers on movie stars. Okay, well, you're in Mesa, Arizona. There ain't no movie stars in Mesa, Arizona. Now you're in Beverly Hills. You could have a shot at that. Working on the lifestyles of rich and famous. What percent of dentists in Beverly Hills never work on a movie star?
I think they all have at least one.
Oh, they do have one.
Yeah, even yeah. In Beverly Hills, yeah, even by process of getting lucky, you're gonna get someone.
So yeah, blood and guts. I mean, and that's mainly because. And by the way, one of the specialties that drives me nuts is public health. Because why should public health only has to be a specialty? Is because number one, a lot of my homies they can't get people out of pain. They can't pull a tooth. They can't start a root canal. I mean, could you imagine going to the hospital with a broken leg and they go, "Oh, I'm sorry, we don't do legs. We just do ears and arms." I mean, come on. It's a public health problem because you can't get poor people out of pain.
We have to go back to money isn't everything. If you're doing something that you don't like, you're gonna hate it. Dentistry is one of those things that if you don't do your passion, you will hate it. So you have to do what you like, because what's the difference between $250,000 and $400,000 if you're unhappy? So we're saying generally, yeah, you want to go towards the more surgical procedures, but if you don't like that, then and you don't like doing it, then it's not worth it. It's not worth it for you. I've seen it. I've seen people be in that situation. So you don't want to. You don't want to hate dentistry, because you don't want to be in someone's mouth and not feel good and have that empty feeling. That's when you hear people being depressed and having all these issues. But in America, no one really cares about, this is what my theory is, no one really cares about what's in your head. They care about what you can do. So like a doctor, if you go into the and not, there's exceptions, but a doctor, unless you're like the person that can get to the root cause and no one else could figure out what's going on with you and diagnose it, they'll be like, "Oh yeah, I went to this person. He saw me for 5 minutes. He wrote down the prescription. I took it. I got better." He went to school perhaps longer than a dentist, but they're pretty underpaid for what they know and what they what their MCAT score was, for example. So my doctor relatives, they always ask me, that are in medical school, I always tell them, if you're interested in money, because money is not it's not a pursuit for everyone, and it shouldn't be, because you will be it's not the end. All you need is a certain amount of comfort in your life, and you're gonna be happy. But I tell them, if you're in medicine, for example, go into surgery where you can go in and someone has a mole and you do a slice and you get $500 for just doing a slice, for example, versus writing the prescription, doing an exam and getting paid $100.
So those are the newer ones were oral radiology and oral medicine, and then oral facial pain, right?
Yeah.
But you're saying oral surgery. Well, how are you saying that? Would those be the 12 dental specialties sorted most to least in demand, or would you say sorted by most to least lucrative, or how are you saying that? The 12 dental specialties sorted.
Yeah. I'm saying it in demand for being in-house in someone's office.
Sorted most to least in demand to come into your office.
Yes.
To come into your dental office.
Yeah, and as a result, it also happens to be the monetary scale, production of in-house too. That same order.
Okay, so my homies are going to be wondering: is what you do, is that only available in California? I mean, if they go to your website, which is synergyspecialist.com,
yeah,
or if they follow you on LinkedIn, I mean, LinkedIn, you're getting big everywhere. Do you only do California, or do you do Arizona too?
No, we do Arizona.
Do Arizona?
Yeah. So yeah, we're I shouldn't say we are. We're applying actually right now for. I'm actually applying for my Arizona license so that we can go into.
You don't have to in Arizona. Arizona's the
Yeah,
only state that recognizes them all.
yeah. So I'm just doing the process, but you're right. I don't have to go and do all that. But I already
Okay.
have my Texas license. We're in Texas, in Nevada. Um, there's some states, Pennsylvania. There's some states where this a little bit more difficult to make happen, and some that are a little bit you know easier. So um, that's kind of we're following the path of where it's easiest.
Well, why don't you come into mine? Why don't you make me your I don't know, what do you call
Yeah,
it?
ambassador, yeah, why not?
Yeah. Well, I mean, or your trial or whatever,
Yeah,
your home base.
yeah.
And I want to do this because I don't like doing Me Too products. Like, I didn't start a dental magazine because someone else did. I started Dental Town. The first unique selling proposition, which schooled me in reality, is I couldn't believe how much bias there was in all the advertising. The only reason they buy that ad is because of the article right next to the ad in all the magazines. Not mine, but in most of them. So I said, you know what? I'm going to start one, no advertising. It's subscription only. And it's $10 an issue. I did that 94, 95, 96, 97, 98. Only 4,000 dentists out of 150,000 general dentists, 30,000 specialists, 2 million dentists around the world. Only 4,000 wanted advertising free. So when dentists tell me, oh, there's advertising, oh, shut up, you wouldn't pay a dime. I post articles every day. That might be behind The Economist or New York Times, a firewall. And some of the richest dentists, who if I said their name right now, you'd say, oh, I know who that guy is. Will say, well, it's behind a firewall. Can you copy and paste? It's like, dude, you're a rich doctor. The New York Times doesn't have a building with employees in it. So I've been a dentist with a DDS and MBA, but I've been a dental journalist since 1994. I'm a journalist.
Yeah, you're a journalist.
And people, they don't understand that, but people don't want to pay for journalism. I mean, they deserve all the free trash they get because they don't blink an eye going to Macayo's to drop $50 on tacos, enchiladas, and margaritas. Then when you say, well, would you like to pay for journalism, something you can trust, like, and they're like, no. So people are very weird. The older I get, the more I realize I'm probably the normalest person that ever lived.
I have a question for you. What's the secret to your success, would you say?
The secret to my success?
Yeah.
Well, I've never had to work a day in my life. I mean, my dad owned Sonic Drive-Ins, and he was the love of my life. And going to work with my dad was like, I mean, I didn't want to go home and play with my 5 sisters. I mean, the oldest 2 became nuns, so they always wanted to play church or school, but I go to work with Dad, and it was everything. And then my next door neighbor, Kenny Anderson, was a dentist, and the biggest technology I ever saw as a child is when he took an x-ray through a tooth, and then we went in the dark room, and he'd dip it in these solutions, and I mean, I was in love at first sight.
Yeah.
I love dentistry. I love everything about. So for me doing dentistry, I just think it's following your passion. It's not work if you love what you're doing. And I love every facet about dentistry. I love talking to you. I love doing a molar. I love retreating a failed molar. I love I'm trying to learn more about the dental insurance. So I am and actually that's kind of a closed secret society. They're not really into that, but I'm trying to. I just love anything dentistry. So it's my love. It's the love of my life. In fact, I love them more than women. You know why?
Wow.
I got very bad news today. I woke up this morning and found out that both of my girlfriends test positive to COVID-19. I mean, not just one, but both. Okay, that's a joke.
I got that.
that was a joke. So my secret of success, and that's what I tell my boys. I mean, my dad was heartbroken that I didn't follow him into Sonic Drive-In, and he kept telling me, by the time you get out of this, number one, if you're going to spend 8 years, you should have at least become a real doctor. That's what he'd tell me. And I'd say, wow. And I said, so Kenny Anderson, your neighbor, he's not a real doctor. Tell him that next time you have a toothache. And then number two, he was right. I mean, a lot of my dad's friends, by the time I got to dental school, their sons already had 3 or 4 Sonic Drive-In franchises and were doing rich. But I just didn't want to spend my only life. I mean, you only get one lifetime.
That's my motto. You only have one time to do it right.
So do you want to make tater tots and onion rings and chili dogs your whole life? Or would you rather do a root canal? And and of course I gotta, but anyway, so yeah, I just say do what you love. And my boys, all 4 of them, what I'm so proud about them is they're all happy and they're all doing what they love. And I think 3 of them could have gone into dentistry, but they had no love for learning the math, the chemistry, the biology. No, they didn't want to be a physics major. But my gosh, so when you come to Arizona, I know what I was going to say. Have my office be a beta site test.
Let's do it.
And be a beta site because it's not it's just a very complex situation. I mean, I know Delta Dental of Arizona is going to give an endodontist more money for a molar root canal. So if I have to pay him 50%, what's my 50%? What's my half of a bigger number? Exactly. Number 2, I want, I love the specialty, treat other people like you want to be treated. I'd rather have an endodontist do my molar root canal than some kid who just got out of dental kindergarten school a week ago. The patient, they only want to go one place, man. I mean, my gosh. Yeah. I mean, they're consumers. I mean, I go to Safeway because for 32 years, I've gone to the same grocery store because if I put it in my mouth or eat it or swallow it, it's all in that building. I mean, they've got it all. They got all the deals. They got everything from Jameson to cabbage. Yeah.
They don't need to fill out new paperwork and new.
Yeah.
They don't. Their X-rays are already there.
And they want to go where everyone knows their name. That's our strength about the DSOs. The DSOs are going to beat you in location, capital formation, real estate, marketing, HR. They're going to beat you in everything, but they'll never be able to beat you on the fact that they still come in and say, well, every time I go in there, it's a different doctor.
Yeah.
And I've been going to Dr. Shervin for 12 years, and I love they want to go where everybody knows their name, and no one wants to go see a different doctor every time they go on for their annual exam.
Yeah. Now, what do you think about? You make a great point because people don't want to bounce around to different. You can get your haircut maybe by a couple different people, but when it comes to your teeth, you want someone that remembers. That you're sensitive to epinephrine, things like that, little nuances that happen.
It sounds like that minoxidil is working on me because you said haircut. I just put it on for the first time yesterday, and you're already seeing hair.
Yeah.
But yeah, they want to go where everybody knows their name.
But what about having your office manager, for example, possibly giving them a stake in an office and keeping them long term and them being the face of some sort of comfort to the patients. What do you think about that?
Well, that used to be my first business model. I got to tell you this is a class example where I was young and making a lot of money in this one business, and I didn't do the business only because I did it one time. It was really fun. I made a lot of money, but I want to have fun playing in other places. A lot of things I play in, I don't make money on, but I want to do it. And here's what I did. I saw another great location open up that was like 3 miles down the street. So I went and signed a 1,000 square foot lease, and the guy wanted $15 square foot. And I said, for 3 years, I said, I'll give you $20 square foot for 5. He said, okay. And this is the guy that I did my first one with. So he said, okay, same thing as last time. You're giving me extra money because you want me to do the build out. I said, yeah, because the guy who built the 20-acre Safeway Walgreens Center can build out your build out for about 1/3 the cost. When a general dentist walks into a contractor for 1,000 square foot build out, you've already been murdered and all your money stole before you even shake his hand. They know green when they see it. So his builders could build that for a fraction of the price. And then I went down to health Healthco, and they loaded the whole thing up with equipment on a 5-year lease to own. So I got a whole dental office, built out, equipped, no money down. This would be my second one. And then when I did, I can't say this on air, but I'm going to say it. You sacrifice your worst assistant, hygienist, and I was saying three people at the bottom. Now Jack Wells, I used to call him Neutron Bomb because he used to lay off the bottom 10% of all of his sales team every year because he's like, okay, 90% of the people sold more than you. How do you not beat that? Mm-hmm. And it worked phenomenally. It was brutal, but it worked. So I got rid of the 3 lamest people in each position. And then I found a dentist who wasn't in school, wasn't out of school, but, she'd been out 5 or 6 or about 5 years. But for some reason, just wasn't in her own place yet. And I see these kids job hopping, going from office to office. Like when I meet anybody in Arizona, if they've been out of the dental schools here, we got 2 of them, AT Still and Midwestern. If they've been out 5 years, they've had 5 different jobs. I mean, every single time. And they can write a book on everything wrong with each place they worked at. And it's like, yeah. I'll come visit your office when you've been open a year. It's really easy to be a critic on a park bench when you've never even owned a Kool-Aid stand. Yeah. But we'll see how you do. And then, so I put her in there and paid her 25% of what the entire office collected. Dentist, hygiene, whatever collected monies, you got a quarter of. And I let her sit there for about 18 months. And then, and all the profit that I made over that, I just reinvested because, they wanted all these extra things, and it's a growing practice. Yeah. And then I would meet my banker, and I remember showing her to Darlene Winger, and I said, Darlene, what do you think? And she goes, yeah, she's doing great. She's doing great. And I said, well, if the sales price is $250, what can you do on an SBA loan? And she said, well, those are 24-year loans. But so I got I did the financing. I got the whole loan approved. And then one day I walked in there, and I said, hey, what are you doing? And she said, what? And I said, hey, you signed this. It's yours. And she couldn't believe it. I mean, it was the happiest day. We're both happy. Yeah. So I get a check for $250,000. I put no money in there, but I was a conductor of an orchestra, so I sacrificed 3 people, but my office manager was the only one that went in there during patient. I never did one filling. I never walked in there one time during treatment hours, and I made $250,000. And I can remember I got out of school, I think in 87. I think I was 23. And this was, I think, in 89.
Nice, 23.
And I was, so I don't know. I think I was like 27, 20, something around there. And I took home that check for $250,000. And I can remember there sitting in my beanbag chair at home, staring at this $250,000, listening to Mick Jagger, at Breakneck Deals, thinking, oh, this is just the coolest thing. Yeah. Calling your dad, your mom, I got a check for $250,000. But the deal is, it just didn't interest me. I mean, a lot of people say, well, you could do 4 of those a year, make $1 million a year. It's like, yeah, I could do a lot of things. Yeah. For that, I could, do all kinds of things. Some guy's trying to get me to go into business with him to set up a marijuana mouthwash, because if you put marijuana in anything, CBD, you'll sell the crap out of it, just whether it does anything or not.
I had a patient yesterday who's doing infused coffee. He's infusing cannabis, CBD in coffee. Crazy.
Yeah. But that's the way humans are. I mean, I cannot believe how many of my patients think the craziest things heal all their diseases, and they're always telling you all these things like that. Yeah. But I love this. I love pioneering, and I would like my Today's Dental to be a one-stop shop for my patients at 32 years. By the way, I don't know if you can tell, even though I turned 58 this month, if you're an 80-year-old lady in Ahwatukee, I'm like the hottest guy she's seen all year. I mean, I got all these old ladies that have been coming for 32 years, and I love them to death. I love hugging them. I love, just everything about it. And I think it'd be really cool to figure out with insurance and specialists and everything. Really cool. Can grandma, when she's 80 years old and she walks 12 blocks to your office, can she get everything done under one roof? Yeah. Or because of you, does she have to get in a car and Uber and go to 12 different places and fill out different records and all that stuff like that? So I just love the challenge of it. And I think it'd be, I love what you're doing. I called you, you didn't call me. And I want Synergy Specialists to work because the litmus test, Google says first do no evil. And then their second motto was just do a shitload of evil. So that was confusing. So my motto was dentist, patient-centric practice. But when you do that, you're a human, you fail, and you end up being a dentist-focused practice. And I don't even know what percent I'm patient-focused, dentist-focused. I like the goal is that we're completely patient-focused, but that's not really yin-yang because, I mean, you're sitting there running late, redoing a MOD composite because the contact wasn't perfectly tight, yet he's never flossed, in 10 years. I mean, are you really gonna run late and redo it
Yeah.
for a guy who's never even flossed? I mean, he
Yeah.
won't even,
Yeah. It's a complicated field we're in. So
yeah.
complicated. So many different factors that you have to keep in mind. And sometimes you don't win. Sometimes you have to just be like, okay, I will take one. I'll take a hit on this one, or I will spend the extra 5 minutes listening to this woman talk about something in her life that's unrelated, and you're falling behind, and your flow, your patient flow. So and things come up in dentistry too. There's issues that come up. No mouth is, no treatment goes exactly as scheduled. Sometimes you find, certain things uh, that you're chasing caries. You go, oh, is it near the pulp or not? Next thing you know, you're doing a root canal. So you have that aspect of unpredictability that happens with what we do.
So when we listed the 12 dental specialties sorted most to least in demand to come into your office, we said oral surgery, endo, perio, pediatric, pros, dental public health, oral path, oral radiology, oral med, oral face pain, dental anesthesiology, and orthodontics last. Um, why is orthodontics last?
Great question. So orthodontics, when I was in dental school, it was such a sought after profession because it was hard to get into, number one, which makes it attractive. If it's hard to get into, and then it must be good, right? If I don't have to use my hands and use my fingers, do all this procedures and complicated things, then it's easy. But obviously we know that it's complex, and it needs a lot of planning and brain power to be able to do these. Obviously, it's physics, and so um, now what we're seeing is you have Invisalign, you have Smile Direct Club, you have uh, machines and artificial intelligence that is being able to process. you know you put these scans into a computer, and then you get an end result, right? And then after the 20,000th, all of a sudden you put the scan in there and it spits out exactly what the realistically happening in offices. And so uh, general dentists are doing these procedures. Non-dentists are doing these procedures, like the teledentistry companies, let's call them, like Small Direct Club and others. So how many people actually need an orthodontist now? It's gone down. So you're left with only these teenage cases where you have to use a headgear and really control the skeletal the dimensions of a patient, and so that's where it's at. It's not going anywhere. You still need that, but my uncle is a orthodontist, and when he in Beverly Hills, and when he came in the 80s, when he opened up his office, he was so busy, and there was only two people in town that you would go to. You go to him or the other guy. That's it. And so all the dentists refer to him, and. So but now you have many generations of orthodontics. So how old is the specialty of orthodontics? It's maybe you know I think it started in like the 70s. Really, they were producing graduates. So and endo was in the 60s. So he was amongst the first, and he went to University of Toronto. He came here and pretty much had a monopoly. And now you have all of these other younger dentists, people coming to Southern California from other areas, saturated. So now imagine someone wants braces. First of all, they type in on Google, and you have a general dentist probably beating out a lot of the orthodontists for positioning in social media and in the search engines SEO. It's and then how much is a case worth? You have, let's call it $5,000 a case. Let's say uh, once a month for 2 3 years. When you divide the number of the chair time, the number of assistants, when you do that math versus, it's not that it's bad. I'm saying versus that oral surgeon that goes in there for, less than, let's say, half an hour or an hour, and never, almost never sees the patient again, or just for a quick post-op if there's an issue. You're competing with other specialties that are much more streamlined and easier and um, not as logistically difficult.
So if someone was in dental kindergarten right now and they said, I don't want to come out during the pandemic, I might as well do a specialty, would you say orthodontics is a bad idea?
If they like it, it's their best idea for them.
Nice answer. But would you go with
I
the
don't
same rate? But if they said, dude, I got $400,000 of student loans, and if they go to become a specialist, they're going to add several hundred more. And then if they marry a girl from their program, now that, they're double trouble. I mean, when two specialists get married at the end of perio school, my God, they're $1.5 million in debt. So would you still go with the same ring if they said, I just want, based on economic return on investment of college tuition, would you still go with oral surgery first, endo second, perio third, pediatric fourth, prosto fifth, and put orthodontics? Well, where are we going to put dental public health, oral path? Oh, there's 12 of them. So let's put them in order. Go through that order for. We'll first go through the full 12 for the 12 dental specialties most in demand to come into your dental office. Oral surgery, endo, perio. What would 4 to 12 be?
So oral surgery, endo, perio, pros.
Prost before pediatric dentistry?
Sorry, pediatric dentistry.
Then prost?
Then ortho, then pros.
Okay, then ortho, then prost.
Yeah. Pros is so difficult to keep because remember, let's say you're starting a case. I've tried to bring a prosthodontist. It's hard to bring a prosthodontist in the beginning when you're implementing a program just for an impression, or because they have to do their impression. Because if it's not perfect, then the rest of the. So if they happen to be on the same block as they are servicing other offices, it works. But it's tough to get implemented. And then what happens over a long period of time is the dentist starts to learn how to do the cases. So they just end up saying, you know what, I can do this full mouth case now. I can deliver this overdenture case. I can do this all on 4 delivery and temporary with the help of a lab tech. So now you have a lab tech who's done it many times with other people. So pros is difficult. It's really hard to implement in the practice. What I have seen and I've been hearing about lately is periodontists teaming up with prosthodontists. So periodontist offices are seeing a decrease in the number of referrals. So they're saying, okay, you know what? It's getting to a point, Howard, by the way, it's getting to a point where periodontal offices are getting less referrals from their peers, because remember, if you have a periodontal office, you're probably middle-aged, at least 40 and above. Okay. Now you may be 50, 60. With each year that goes by, more and more people are retiring and referring less. Okay. So now you're at the point where you're getting your referral base is drying up more because people are bringing in-house and people are doing themselves more, and people are doing laser for perio. They're bringing in a periodontist that's doing wisdom teeth. People are getting creative. People are, everyone's trying to do more. I didn't used to do wisdom teeth when I came out. Now I'm doing them more and more. The because I feel comfortable. I'm doing complicated surgical extractions here. I just take it a little bit farther back, make sure I have the scans, and I'm in a safe place. So everyone's pushing their limit. So that's where I'm seeing it go. Where periodontists are now reaching out to prosthodontists and saying, "Okay, come to my office and now restore this $50,000 case, and let's split that money."
So then after Prost, you still got to sort for me oral path, oral radiology, oral medicine, oral facial pain, dental anesthesiology, and public health. I assume dental public health would be last.
Yeah.
So what would come after Prost? Would it be dental anesthesia? Or would it be oral radiology, oral med, oral facial pain?
Dental anesthesia.
And then what would be next? Oral facial pain?
Yeah, oral facial pain, oral medicine.
Well, those are two separate. Oral facial pain, then oral medicine?
I'm not qualified to know the difference, really.
Yeah. So oral surgery, one, endo, perio, pediatric, ortho, prost, anesthesiology, oral facial pain, that includes all your TMJ and all that. Then oral medicine, oral path, oral radiology, and dental public health would be last.
Yeah.
And what would be worse, a pediatric dentist where you spend your whole life with just a bunch of crying, screaming kids, or oral facial pain with all their crazy mothers? Which would you rather have, the crazy kid or the crazy mother? I mean, I think what I want to do, I want to start a pediatric dentist, oral facial pain for the crazy kids from the craziest moms, and just sit in there until you just take the high-speed drill and drill a hole in your own temple and then suction it out.
With pediatric dentistry, don't you have both the crying kids and the crazy mothers?
With pediatric dentistry and what?
And with pediatric dentistry, you have both the crying kids and the crazy mothers.
I don't know how they do it, but I have noticed this though. I will say this, and this sounds sexist, but I've already seen this pattern. When I was little, all the gynecologists, all the OBGYNs, they were all men, and now they're all women. I mean, that's so obvious. I'm seeing the same thing with pediatric dentistry. I mean, I've been into many schools, and they say, "Oh, here's our 6 students in the ped program." They're all girls.
Yeah.
And if they're not, maybe one guy. But so I do think women are going to take over the majority of pediatric dentistry. I mean, hell, look at what they're doing. 70% of the valedictorians in high school last year was women. That's the undertalk thing. I mean, no one wants to feel sorry for a bunch of young men because it's always been a man's world forever. But my God,
women have they're more mature. Their brain develops faster. They don't have that crazy testosterone going through them when they're in high school.
Oh yeah.
So they have an advantage, definitely. And even later on, that they got that woman's intuition. I know my wife has it. I mean, it's there. Women are smart.
Amen. But hey, I can't believe I asked you for an hour of your life. You gave me 2. Thank you so much, Shervin, for coming on the show and talking about this in such a timely manner. And I hope all my homies go to your mouthcovid.com. And thanks for all that you're doing in dentistry.
Thank you for having me.
If you come to Arizona, seriously, I mean, I'm right where the 2 interstates meet. I-10 goes from L.A. all the way by the way, that is the Panama Canal, if you did not know that. Did you know that I-10?
Is the what? The Panama?
It's the Panama Canal. Because when you're coming from Asia, you either drop everything off in L.A. and they put on railroads on I-10 and run it from L.A. to Phoenix to Tucson to El Paso to Houston to New Orleans all the way to the Atlantic Ocean in Florida. Yeah. Or you got to sail 2 weeks south to get to the Panama Canal, pay $140,000 to cross it, and then 2 more weeks up and your fuel. So it's cheaper to just pull into L.A., throw that all on double rails, and run it down I-10. That's why what I love the most about where I live is in Kansas, you always got to hear those trains. And then the city people, they don't ever hear trains. But I live close to I-10, And my God, and then when you climb up some of these mountains I like to go on hikes on, and you can see these trains coming. I mean, they're miles long of double deckers, but that is the Panama Canal. But hey, I'm so impressed with your mind. You're one of those amazing brainiac geniuses, and love your research. Congratulations on setting up two research journals. And by the way, which is the better school, USC or UCLA? You went to both. Or at least give me your best joke. I mean, what's the best UCLA, USC joke you ever heard in your life?
Well, you go to UCLA and then you're watching UCLA basketball. So that I root for basketball there. And then I root for USC football. That way I'm always a winner.
Oh my! Well, a guy from USC, he told me that if you drive by UCLA real slow with your windows down, they'll throw a diploma in your back seat.
Yeah, that's funny. That's funny. Yeah,
I love the trashing jokes between U of A and ASU.
Yeah, I know, but people always say, like, you went to, because I went to undergrad there too, to college, university, and dental school at UCLA. And then there's, people are like, oh, you finally saw the light, or you kind of finally wanted to get polished a little bit. So
oh my God, my favorite dentist in Arizona to talk to. I went to ASU, of course. That's obviously that's the best one, and of course U of A. Everybody knows that's just garbage. And I love enjoying talking to my U of A homies the most, just so I can trash talk them about that all the time. But hey, Shervin, thank you so much for coming on the show. It's been a real honor. And hey, if you ever want to do an article on Dental Town or online CE course, especially with the pandemic, we have 400 one-hour courses. They've been viewed 1 million times just because of the pandemic, and the classrooms and conventions are going down, online CE is going up. So love to get any online CE articles from you.
I've been doing a lot of writing lately, so I would definitely be interested. Yeah.
All right, buddy.
All right. Thank you.
All right. Thank you so much. Have a great day.